And good afternoon. My name is Rich Coleman. I'm the host for the Prevention Corner, and today we're going to be talking with the Public Information Officer here at the Washtenaw County Public Health Department to provide an awareness of the West Nile virus. This information is currently in the news and print as well as in our television programming around the country with our 24-hour news coverage. And our concern right now is making sure that there is an awareness for our community members about West Nile virus, the symptoms, what we need to do with eliminating standing water or where the breeding sources are with the West Nile virus, but also the importance of what can we do as community. This information that we're going to share today is provided on a huge awareness from the CDC, the Michigan Public Health Department, and the concerns that we're seeing across the country. Michigan is 7th in the 10 states that are recognized with information and incidents of reported West Nile virus. This is the 24th of August, and as of this day, we have had and being reported the third death here in the state of Michigan. And this is something that our public health entities are talking about, they're providing an awareness of, but also what can we do as community to understand, to know what to do, and how are we going to respond to making sure that we monitor the 3 R's that we're going to talk about with standing water and things that we can do here in our community. Let's go inside. Let's talk with Susan here at the Washtenaw County Public Health Department. She is the Public Information Officer who's providing us with some outstanding information about what we can do. We're going to be putting the website information up here at the County Public Health Department that you can find and get details about the West Nile virus. Let's go and talk to Susan.
Have you heard the buzz about West Nile virus? Protect yourself and your family from the mosquito bites that spread the virus. Use mosquito repellents when you go outside. When possible, wear long-sleeved shirts and pants. Remove standing water where mosquitoes breed. Most people who get West Nile virus don't feel sick, but it may cause serious illness. Fight the bite. Tell mosquitoes to buzz off.
And good morning. This is Rich Coleman. I'm the host for the Prevention Corner. And today we are here at the Washtenaw County Public Health Department talking about a very important issue impacting all of our communities around the country, and that is the West Nile virus. What we've seen happen with all of our media coverage, not only the fear, but the concern about standing water, those who are sick, symptoms, things that are going on that you may not be aware of if you are during dusk and dawn bitten by one of the mosquitoes. Today, we are here at the Public Health Department, and we're going to talk about symptoms. We're going to talk about what communities are doing, but also the national perspective. This isn't just a local issue. This is a national perspective. If you look at the history of this, back in 1937, in Uganda was the first time that it was actually discovered. When we look at when we started seeing it here, 1999, here in the 50 contiguous, and it's just continued to grow. And as we know, as mosquitoes and these things, as they migrate and as they change, they adapt. What we're seeing now is an adaptation, and with more mosquitoes where they are and the things that are going on. Susan, thank you so much for being with us today. Please introduce yourself.
My name is Susan Cerniglia, and I work here at Washtenaw County Public Health, and I am the Public Information Officer.
Fantastic. So let's talk about this national perspective. We've seen tremendous media coverage over the last couple of weeks regarding the West Nile virus. How big is this issue from a public health perspective at the national level? I know that the CDC is involved with a number of recommendations and working with state and local governments. What is this issue meant for Washtenaw County?
Well, for us, it's something we're very concerned about. We're not seeing the level of a problem that they're having in places, for example, like Texas, where they're seeing a lot of cases and a lot of deaths. But nationally, the number of cases is over 1,100 now, and that's more than has been seen at this time of year since we first identified the virus in the United States in 1999. So, of course, there's a lot of concern about how bad that could get. We know going into this year that because of the particular weather conditions that we were having, the mild winters and this hot, dry summer, those conditions are very favorable to the type of mosquito that is most likely to carry West Nile virus, and that's a Culex mosquito. And so those mosquitoes can breed in little tiny pools of water, and that's why the emphasis on getting rid of standing water. Even though it's been very dry, we don't want water sitting around in toys and buckets and anything around the yard. This is not necessarily what we're most familiar with, that nuisance mosquito, that mosquito that thrives in the wet, marshy conditions or in the deep woods. This type of mosquito can really be in our suburban, urban areas.
So we talk about the 3 R's, and we're going to put this information up on the website as well. That's posted here at the Public Health Department. And we're talking about standing water. That could be in children's toys. It could be in any type of item that could hold water. What about barreled water? I know that we have a lot of conservative water conservation and reusage of water. What about the rain barrels? Is there some emphasis there?
I think those are designed so that they're covered and closed and shouldn't be as much of an issue as something that's open and standing that the mosquitoes would have easier access to.
So a number of our subdivisions around the areas have common elements, and they have drainage ponds. Is there a concern for those subdivisions and homeowners association areas where there are drainage ponds? And even though I know in our area, some of them have actually dried up, and they're small pockets, should there be a concern about those areas as well?
Generally, there is a concern, and we want to avoid those standing sources of water. However, where we're at right now, that we have West Nile activity and we have human cases, that means that the virus is already active in adult mosquitoes. So while going forward, eliminating that water can prevent additional mosquitoes from hatching, our main concern right now is that it's already what the mosquito experts call on the wing. That means the adults have it, they can be out there biting. So we really have to focus on that personal protection, making sure if you're going to be outside that you're going to wear some long clothing, that you're going to use repellent, and you're going to use it properly. You know, it can be very safe if you're following the manufacturer's instructions. And we want to make sure to kind of avoid those primary times of day, that evening, that early morning when they're most active. We want to make sure that doors and windows don't have holes that mosquitoes could come in and hang out inside the residence home at night and bite them, you know, when they're not outdoors. So we want to make sure that there's not ways for that to happen or for them to hitch a ride inside. And really just emphasizing that at this point, we need to prevent mosquito bites as much as possible.
Now, what about our children? I know that there's a lot of concern regarding small children and those type of topicals that are recommended, and the mosquito repellents in DEET, D-E-E-T is the foundation of those formulas. Is there a concern about children less than 5 and using those type of products that the Public Health Department is concerned about?
Our recommendation is not to use a DEET-containing product under a child 2 months of age, but again, if it's used according to the manufacturer's instruction, it should be safe for children over 2 months of age. And the good news is there are some alternatives now that are considered perhaps safer or more natural than the DEET. There's the picarin and the oil of lemon eucalyptus, and those are considered EPA-registered active ingredients and should be very effective against repelling mosquitoes.
I know that at the website, we're going to be putting the website information up here for the County Public Health Department and all of the resources that are linked with the CDC and the state of Michigan's public health entity that is really promoting an awareness in all of the counties, all 81 counties here in the state of Michigan. And we look at those specific numbers when we see the articles in all of our various media sources about how many lives have been lost thus far. And we're now up to 3. Is that right? We're up to 3 now?
Yes, so far as of yesterday, we had 3 reported fatalities. One of those, as we know, was in Washtenaw County. The other 2 have been in Detroit and Wayne. And there's always a lot of concern, and of course, it's awful. But what we want to be aware of is that even though we had a fatality, for example, in this area, it doesn't mean that there's a higher risk, for example, where that person lived. We know that we have West Nile activity in the animal population, which by that I mean birds. We take reports of dead birds because they're a very sensitive indicator of West Nile activity. And we know that we have that activity across the county. So our human sort of nature is when there's a fatality, people want to know exactly where that person lived, exactly what they were doing, and those kinds of things. And from a public health perspective, what's important here is that we do have risk and we have West Nile activity. Again, it's not an emergency situation like is really happening in some other areas, but we want to be cautious. We want to prevent mosquito bites as much as possible and prevent it from getting worse, prevent the number of human cases. And in reality, the majority of people that are exposed are not going to get ill either, and that's very important to recognize. The number of people that are going to get seriously ill from this is very, very small, but obviously it can be serious. And there's particular risk for people over the age of 50.
And that's what I was going to ask about, because when you see that in the stories about if you're over 50, you have to be of greater concern, and then those who are under 50 don't take it seriously. It's like, okay, I'm not 50 yet, so I don't have to worry.
Right.
Is that like misrepresentation of the huge concern that's out there with this West Nile virus?
Well, again, we want everybody to do what they can to prevent mosquito bites, because you simply don't know if you may become mildly ill or severely ill. And statistically, the numbers tell us that folks over 50 are just more likely to have serious complications.
Now, one of the things, too, that we're seeing in a lot of the reports regarding symptoms, and I think this is a big part of not only the research that I've been doing and preparing to disseminate in our community, because a couple of years ago, I think it was 2005, in Pittsfield Township, I had reports even coming into our neighborhood watch groups of finding dead birds. But the website says now, if you find a dead bird, don't call us because we're not going to pick it up. We do want to know about it. Just put gloves on, put it in a bag, and put it in a trash receptacle. But please report it. Is that still accurate?
Yes, we still do want those dead birds reported because they are an indicator of West Nile activity, meaning that the mosquitoes have infected the birds and the birds are very likely to become ill. Unfortunately, several years ago, as a health department, we became unable to test those birds because of budget constraints and so forth. But we do take the reports and we track them and monitor them so that we could see, for example, if there really was only a particular area in the county that was of concern, we might be able to see that through those reports. However, that is not what we're seeing this year. We are seeing widespread activity, and so our message is widespread caution in terms of repellent and personal protection.
So I think that's one of the things, too, that we really want to encourage with our audience is to be cognizant across the board, not just because you're under or over the age of 50. These are the things that are very real that are going on with this epidemic. And as far as symptoms, and it's something that they're not like jumping right out at you as far as the degree of, oh, it's West Nile. That's not really how the symptoms occur. Can you talk a little bit about what types of symptoms and immediate medical care that someone should seek if they start feeling some of those symptoms or family members seeing those types of symptoms?
Unfortunately, like a lot of these type of illnesses that we deal with, they exhibit what we call flu-like symptoms, so that generally not feeling well, kind of lethargic, perhaps a fever, and typically mild. It's a very small number of cases that will become more severe, and those severe cases can result in encephalitis and meningitis, in which an individual will feel much more ill, will feel a lot of lack of weakness, lack of muscle control, perhaps stiffness and that sort of thing. The mild illness doesn't necessarily need to be treated. It will likely resolve on its own. However, because there's a lot of concern right now, people should certainly feel very comfortable talking to their medical providers and getting their advice about whether or not they should be seen.
Yeah, and we're going to have that information that's available here at the County Public Health Department's website, the contact numbers, information from the CDC, and all of those other resources that you guys have put on the website, which is absolutely fantastic. I applaud our Public Health Department with the resources that are available. The municipalities, because a lot of our community members are also going to call and say, we've got standing water, who's going to do something about it? It's not in my yard, it's in an area over there where there is a foreclosed home. One of the things I read in the reports about swimming pools or areas, because we have so many foreclosed homes and vacant properties, how is that being handled when it's being brought to the attention of the local municipalities?
Well, unfortunately, as we know, in recent years, there's been a severe reduction of budgets in local municipalities, and that has affected the type of programs and services that are available. So it's pretty likely that if a community had something like a comprehensive mosquito control program in place, where they might have been treating storm drains, they might have been treating standing water to make sure that it wasn't a breeding ground. Some of those programs over the last few years have probably been eliminated. And as we know, that advice is sort of feeling counterintuitive this year because we haven't really had a severe mosquito problem. I know I have not, had trouble just walking out into my yard and feeling like I needed repellent. And so this advice to kind of use the repellent feels a little counterintuitive. But it's because those nuisance mosquitoes, there's fewer of those, but there are more of this Culex type mosquito. Now, as far as current standing water, like we talked about, the adult mosquitoes are likely already carrying it. So treating those storm drains, that standing water, isn't necessarily going to have a big impact right now. However, going forward, if this type of weather continues, it could have a big impact next year. So we will be talking to our local units of government, our local municipalities, to consider putting back into place, if they've eliminated it, if they never had a program, to consider doing some level of larviciding. Historically, communities that do have some type of mosquito control in place tend to have fewer cases of West Nile virus.
Yeah, and I was reading, looking at some of the national reports, some of those communities, because of budget cuts, completely have eliminated their mosquito control units to battle this amazing and challenging issue right now. So this is something that we, as our community members, are seeing standing water, may not be on their property, but at least make sure that they notify the local governments.
They could certainly talk to their local units of government and see what, if anything, is already known or being done about that property. And then, like as we said, homeowners can do a lot to eliminate any small little pockets of standing water around their residence.
Yeah.
West Nile virus is a disease that is transmitted by a mosquito feeding off an infected bird and biting a human. This disease manifests in a host body within 2 to 15 days. People over the age of 50 and babies under the age of 2 are most likely to get West Nile virus. The virus can also be passed through organ transplants in pregnancy. Horses, cows, and birds can also develop cases of West Nile virus. Although not severe in most cases, West Nile virus has been known to kill. West Nile virus has no cure but is preventable. Putting on bug spray repels mosquitoes and can be effective in preventing mosquito bites. Wearing long-sleeve shirts and pants can decrease the likelihood of mosquito bites by reducing the amount of exposed skin. Eliminating standing water can be effective in reducing mosquito populations. Mosquitoes lay their eggs in standing water, larvae mature, and new mosquitoes are born to repeat this cycle. Dusk and dawn are the main active periods for mosquitoes. Avoiding being out at these times can cut down the risk of coming into contact with an infected mosquito. Window screens and mosquito nets are a very effective way to avoid mosquitoes because it eliminates the possibility of mosquitoes entering your house. Follow these steps to prevent from being a victim of West Nile virus. Thank you.
This is fantastic information, and we hope that everyone who is involved with these programs and looking here at the County Public Health Department and being involved with this outreach can provide this assistance to whoever calls. We're going to put the telephone numbers up, the website, contact information so that everyone will be able to get access to it. Any parting words as we prepare to close out this segment that you can provide for the community?
Again, I just kind of reiterate that this right now is not an emergency for us. We're not panicking, but we do want people to be aware that we have West Nile virus activity and to consider that personal protection, that repellent, and so forth.
Fantastic. And as we prepare to get ready for school, we're going to have a lot of back-to-school activities. Children will be out on the playgrounds. Is there a concern that school personnel, the school nurses and parents, as we prepare to head into school, that there should be a concern about this right now? Because we're at the beginning of the huge real issue as they continue to evolve.
Yeah, I mean, children going back to school, there's always things that start to circulate more as people are in closer contact with each other. However, as far as being outside during recess and that sort of thing, because our mosquitoes tend to be more active at dusk and at dawn, there shouldn't be a real heightened concern about this particular issue with school resuming. But of course, we will use that opportunity to get information out to our schools and increase awareness and make sure folks are using their repellent when they are outdoors.
You know, one of the things, too, is as I was just thinking about some of the literature that I read and the comments and the concerns that if someone, a family member or someone that you know that may have West Nile, that you're afraid to touch them, they think it's contagious. Is that a myth, or is that reality, where if you are around someone who has West Nile, that if you're with them and they're your loved one, you can't touch them, that you might get it?
No, with this particular illness, it's not transmissible by touching, by being close to someone. It really is transmitted by that mosquito bite, by that infected mosquito. So as far as, unlike other communicable diseases where we really might want to worry about personal hygiene in terms of covering our cough or keeping our distance from someone else, West Nile is not like that. We really have to worry about the mosquitoes.
Fantastic. Well, Susan, thank you so much. Again, we're going to put this information up on the screen about all of the resources that are available here at the Washtenaw County Public Health Department, as well as our CDC in our state of Michigan, links that are all embedded at the county website. There are some fantastic PDF files that you could download, as well as forward to others who might be interested. And we all should be concerned about the magnitude of the West Nile virus epidemic before it gets to this fear factor, but also being prepared. That's the biggest point that we want to stress today. Again, my name is Rich Cohen. We're here with Susan, here, the Public Information Officer for the County Public Health Department, and we're going to provide you, again, with the information of how you can help protect your family and have an awareness of how to prevent the West Nile virus, as well as if you are someone in your family has been or shows symptoms, to make sure that you get immediate medical assistance. That's so important. Thank you so much.
¿Ha oído hablar del virus West Nile? Protéjase de las picaduras de los zancudos que transmiten el virus. Use repelente cuando salga al aire libre. Si puede, use camisas de manga larga y pantalones. Bote las aguas estancadas porque son criaderos de mosquitos. Muchas personas infectadas no se sienten enfermas, pero el virus West Nile puede causarles enfermedades graves. No se dejen picar. ¡Fuera con los zancudos!